Hello and welcome. You're watching the Newstrack. I'm Rahul Kanwal. The one question uppermost in people's mind at this moment is this. What will this Omicron wave look like in India? When is this third wave likely to peak? How big could that peak be? What are the estimates? What are the projections? What are the top experts saying? We've looked at the data that the government is tracking very closely, and we'll put that out exclusively on the Newstrack tonight.
Super mutant Omicron spreads. Over 200 cases across 15 states. Curbs back, center sounds alert. A third wave looming? Is it time to roll out boosters? Are our kids safe? Brace for Omicron. Big focus on Newstrack.
At this moment, 220 cases of Omicron have been reported across India. The numbers, according to government, are doubling every 3 days. This super mutant has spread now to 75 countries and is ravaging the UK, US and Europe. The one question which everyone's been thinking about is this. When will Omicron start peaking in India? How long will that peak last? How bad could things be when Omicron starts to peak? And by when will this nightmare begin to end? We want to show you this report. We'll have some top experts joining us who are looking very carefully at these models which are suggesting what the Omicron variant in India could look like.
When will the third wave hit India? And how bad will it be? These are the few questions baffling epidemiologists for a while now. Latest projections by the head of COVID Supermodel Committee, Vidya Sagar, and IIT Kanpur Professor Manindra Agarwal suggest the third wave may unfold by February. The projections suggest India is likely to witness around 1.5 to 1.8 lakh cases every day by the end of February. The only silver lining in all this is that this wave is likely to be less severe than the second wave that was driven by the Delta variant. The fall in cases after hitting the peak is also expected to be quick. Projections also suggest that hospitalization will be low since a significant number of Indians will be fully vaccinated by then.
The most pessimistic scenario, which is you have totally lost any vaccine protection and the natural immunity due to prior exposure to Delta is eroding very quickly, we foresee a peak of something like 1.5 to 1.8 lakh cases per day happening somewhere towards the end of February.
Okay. These projections are made keeping in mind the Omicron threat. In South Africa, the COVID cases, after peaking in mid-December, are seeing a sharp decline. The average daily deaths were less than 50 during the peak.
A very, very sharp peak, very quick rise followed by very sharp decline. Again, as Professor Agrawal has pointed out, we can look at South Africa as a model. They had peaked in just under 3 weeks. And now the number of daily cases in South Africa is 33% lower than the peak. So that means a sharp drop in cases in just 1 week's time from the peak.
But with Omicron cases rising to over 200 in the country and over 5,000 new infections being reported on Tuesday, the picture can change rather quickly. With Sneha Murdani, Bureau Report, India Today.
We'll be diving into these numbers in just a moment, but before that I want to show you what the government is doing to gear up. The Prime Minister will be chairing a crucial meeting on Thursday to review the current COVID situation in the country. The centre, meanwhile, has sounded an alert and asked state governments to be extremely vigilant. Just days before party season peaks, Curbs are back. Gatherings have been banned in Delhi, Mumbai, Bengaluru. Omicron is all set to play party pooper.
A super mutant variant, another looming COVID wave, steadily climbing tally. A concerned government is now stepping up the Omicron fight. Prime Minister Narendra Modi is to hold a big review meeting on Thursday. The centre has also issued directives to states to step up measures to contain the Omicron spread, advising states to set up war rooms, impose night curfews if needed, and carry out door-to-door contact tracing and searches. The centre has also asked states to enforce home isolation and accelerate measures to ensure 100% vaccination. Delhi Disaster Management has banned all kinds of functions in view of Christmas and New Year. While parties themselves are banned, strangely, 200 people are being allowed to attend marriages and other such functions at the same time. The Delhi government has also imposed curbs on large gatherings and restricted seating capacity in restaurants to 50%. These curbs will remain in place till the end of the year.
Due to the rising Omicron cases, the DDMA has extended its pre-implemented COVID curbs till the 31st of December, due to which restaurants will still have to operate at a 50% capacity and large gatherings continue to be prohibited along with all religious gatherings.
Restrictions have also been imposed in Mumbai, where parties on terraces and beaches have been banned. However, Mumbaikars will be allowed to hold indoor parties with 50% capacity. Gatherings with 25% capacity are allowed in open areas. Special approval will also be required for a gathering of over 1,000 people.
BMC officials is also saying that it is keeping an eye on the situation. If continuous rise in the Omicron cases are there in the city, then more stricter curbs can be applied.
The Karnataka government, meanwhile, has also imposed a ban on mass gatherings. Restaurants and bars will only be allowed to function with a 50% customer capacity. No special events or DJ parties are being allowed anywhere in the state of Karnataka. Tourists who've been flocking to Goa in the holiday season will face an imposition of Section 144, which prevents gatherings of more than 3 people. The state government has also been asking people to adhere to social distancing norms and wear masks at all times. Many of these rules across cities and tourist destinations in the country could intensify in the days ahead. India Today will keep you updated. Bureau Report, India Today.
What could the Omicron peak in India look like? How long will this peak last? By when will we hit the peak? By when will this nightmare end? These are difficult questions to answer, but I've got two specialists who are looking very carefully at the modelling, at the numbers, and they're joining me on this broadcast. I want to welcome Professor M. Vidyasagar. He's the head of the National COVID-19 Supermodelling Committee. He's spending all his time looking at how this variant is spreading. We have with us Dr. Subramaniam Swaminathan, Director of Infectious Diseases at Gleneagles, the Global Health City. And later, when I come to the politics that's playing itself out over booster dose and whether the government is taking the wrong decision. You know, they've been caught out on a couple of occasions in the past. Are we just avoiding the inevitable? We will have to go for booster doses, but are we doing it too late? We'll have Ajay Kumar and Shahzad Poonawala of the BJP. But first I want to go across to Professor Vidyasagar. This report that we played out, compiled by the India Today Data Intelligence Unit, which looks at modelling being done by different government agencies, seem to suggest that the peak could happen sometime in February. The other indication is that it could be a sharp rise and a sharp fall, that it needn't be a very long wave. How are you arriving at these conclusions? Are you certain that this is likely to be right? What is your confidence interval at this moment? And what are you broadly picking up from what's happening abroad about how Omicron could start spreading in India? Professor Vidyasagar, welcome.
Yeah. Can you just first confirm that you can actually hear me, because there was some difficulty earlier?
I hear you well.
Okay, thank you very much. So, first of all, in terms of confidence, let me say that what we have done are not prediction, they're projection. The distinction I'm trying to make is that when you have data, you make predictions, but when you don't have data, only possibilities, you lay out a bunch of scenarios and see what could happen. So in terms of your last question, what is happening elsewhere. So we should look most closely at South Africa, because South Africa has very high seropositivity. Large fraction of their people have been exposed to the Delta variant. Whereas if you look at the countries of Europe and USA, they have had much lower exposure to Delta, but higher vaccination penetration. So I think that South Africa is a good guide for us. And what you can see about South Africa is the following. They first mentioned this Omicron variant on November 26th. That's when it broke. The number of cases peaked. The 3-day moving average peaked on December 14th. So that was barely 3 weeks from the time that the variant was first identified. Today, the 3-day moving average is about half of what it was a week ago. So the climb was in 3 weeks, and the drop is being very short.
But can I pause you just to make this interjection? That the quality of data being released by South Africa itself is being questioned by infectious diseases experts and epidemiologists world over, because like is the case with some countries, unlike say the US and the UK, where you know fairly well what the actual situation is, South Africa is being criticized for not putting out its data clearly and cleanly. So when you're saying there is a 3-week rise and fall, how, and if you're basing that on what's happened in South Africa, how certain are we that the base case that we are looking at is actually robust?
Well, let me tell you very bluntly, as people who have done modeling, that South African data is much clearer and much smoother than the data in the USA from UK, which is jumping all over the place. I mean, in the USA, you have cases going from 40,000 in one day to 1.2 lakhs the next day. This is simply not credible. So I don't know who these so-called experts are that are questioning the quality of the data. I have been quite pleased with the internal consistency of the South African data. So maybe it's just someone's view of the world is different from my view.
Okay, so let's now project. Basis what we've seen in South Africa, it's a country in some ways similar, in quite a few ways dissimilar to India. But if you were to extrapolate that to India, when do you see COVID starting to peak? At this moment, a lot of people who are watching are reading about Omicron, but they're saying, yahan to kuch hai nahi, aisa ye wahin pe ho raha hai. When do you see the graph starting to hit that hockey stick like ascent?
Yeah, definitely. I think you're making a very valid point. I mean, people were similarly complacent in January, February of this year. They just assumed, why do we need to bother with COVID-appropriate behavior and all that? And the fact, as you correctly pointed out, is that when the pandemic begins to rise, it in fact does go up like a hockey stick. So the whole point of modeling is to forecast this kind of a scenario and give the government advance warning of something between 2 to 3 weeks so that they can prepare for that. So our projections right now are that the peak should come somewhere towards the end of February. And in the worst case scenario, it should be something of the order of between 1.5 to 1.8 years. It could be much lower than that. Our worst case scenario is 100% bypassing of vaccinations. You understand? We assume that vaccinations that people have got will give you no protection against COVID. Because people have to know what is the worst case scenario. If you assume that only half of the efficacy is reduced, the peak drops to something like 1.3 to 1.4 lakh. And if you assume that current vaccines actually do give you protection against Omicron, then the peak drops to about 1 lakh.
But what we are picking up from abroad is that current vaccines don't seem to be protecting fully against Omicron. Your immunity does drop quite a bit. So if it's about 1.2 to 1.3, which is your middle level projection basis part efficacy on the back of a second dose, what are the kind of hospitalization and death numbers that you are projecting for India, sir?
So again, for hospitalization and death numbers, we don't really have reliable projections from any country, including South Africa, including UK, because those are all lagging indicators. Number of cases will rise very sharply, and the hospitalizations will follow about 2 or 3 weeks later. But whatever we have seen from South Africa, which is where the Omicron first hit, the hospitalizations have not been commensurate with the number of cases. And surprisingly, the number of deaths have not gone up at all. Now, that could be because of the lag. I want to make that point very clear. We need to revisit that number, say, a week or 10 days from now. But for the past 2 to 3 weeks, the number of deaths has stayed very, very flat. And hospitalizations have gone up, but not commensurately with the number of cases.
Okay, so we've heard so far from the head of the National COVID-19 Supermodeling Committee, and I appreciate you taking out time. Please stay with us. I want to go across for an independent perspective to Dr. Subramaniam Swaminathan. He's the Director of Infectious Diseases at the Global Health City. You're doing your own estimates. What we've heard from the head of the Supermodeling Committee is that a peak towards the end of February, a sharp ascent, a sharp decline, about 3 weeks from a baseline figure to the peak and then downwards. Is that the way you're reading these projections as well?
I worry that's an underestimation of the speed. So please understand that the doubling time is somewhere between 1.5 to 2 days. That is a very, very, very fast wave. It's by calculations, it's about 5.4 times, about 5 times faster than Delta. So there is good data to show that the hospitalization is 1/5 of Delta, but the severity among those hospitalized and the bad outcomes is comparable to Delta if you are hospitalized. But since it's going 5 times the speed of Delta, that effect will cancel itself out. The concern is that it's going to be a short, very sharp spike and a down again. My suspicion is that we'll probably have the peak in Jan itself, and the wave will start now. See, there's no way out of the wave. This does not take into account the fact that a lot of children are getting symptomatic COVID. They're not falling sick, they're not falling grievously ill, but they are developing symptomatic COVID in South Africa. And those numbers will account for a lot, because traditionally we don't test children as much. But now, once we start having febrile children, I suspect that we'll start testing for that and we'll start finding all of that. Case positivity rates have
Let me pause you to ask this, sir. What explains the difference between the timeline that you're picking up, which suggests that the COVID Omicron wave could peak in January, and what the government estimates seem to suggest about end February? Why is there a difference in the two projections? I'm coming back to you, Professor Vidyasagar, in just a moment. I'm just trying to understand from Dr. Swaminathan.
But it's not the government's estimate, it is our estimate.
Oh, sure.
The government has no role in it.
Most certainly. I appreciate that. Dr. Swaminathan.
See, I'm not going to tell you what my modeling is. I'm sorry. Having said that, my estimates are in the public domain of what I've said so far. Whether it's the first wave, the second wave, the rise and fall of the second wave, and things like that. So I'm not going to tell you that. What I will tell you is this.
No, why not? I'm sorry. I'm just asking a straight question, which is good for a public conversation. What explains the difference between when you're picking up a wave and them?
See, I'm looking at the data very carefully. See, the South African data internally is very, very consistent from what I can see. And the pattern, when you break it down province by province, is following the same rule, playbook. The rise and fall is happening in the same way. So the point is that there is a uniformity in the way the rise is happening and the fall has also started happening. Now, if you look at South Africa on the whole, the number of positivities has already started falling. And remember that this started rising end of November, and we've already peaked. So point is that it's not just Gauteng, it's not just some other province. All provinces are showing a case load which is remarkably similar. And you know what, with so much uniformity, you'd be hard-pressed to say, no, that is an outlier. And it's very difficult to ignore that kind of homogeneity in the epic curves that I'm seeing.
Dr. Vidyasagar?
That's one example.
Explain this difference between end February and what Dr. Swaminathan is saying, that he thinks it will happen in January, and he believes that you seem to be underestimating the speed at which Omicron will spread in the country.
Well, no, we're not really underestimating it. So just about the only reliable number, I just want to repeat, I apologize for interrupting you, but when you said it's a government's estimate, I want to make it absolutely clear, this is not a government's estimate.
Sure.
This is the estimate of the super team. So we looked at the rate of spread of the Omicron variant vis-a-vis the Delta variant. Now, if you look at when the Delta variant hit us in about March of this year, it was spreading at about 70% faster. That means the rate of spread is 1.7 times the predecessor. And what we are able to see is that the Omicron is spreading approximately 2.2 times faster than Delta. So we put that into our model. And the other points about the immunity escape from natural immunity and the vaccine escape, all we can do to generate scenarios. Now, the one scenario which we haven't modeled is we have 100% vaccine escape and 100% immunity escape. Because then you have a fresh disease. That means you're totally vulnerable. So that is perhaps what Dr. Swaminathan is looking at, I do not know. I would like to point out that our modeling methodology is completely in the public domain. The equations are all there. Anybody can simulate those equations, and if they program them correctly, they will get the same answer.
Good, I appreciate that. There should be a robust debate about modeling, but nonetheless, Dr. Swaminathan is entitled to his view. But I have this question to ask. There are two big debates taking place. One, vaccination for children and booster doses. On the basis of what you're picking up from South Africa, the UK and the US and elsewhere, Dr. Swaminathan, what would your view be? Should there be vaccines for children which are allowed expeditiously?
See, the fact that we need to give vaccines to children is a foregone conclusion. The only question is when. My personal opinion, it's not the time. Why? Because the case fatality and the severe COVID is still restricted to those who are very vulnerable. That is the elderly and those who are medically debilitated and those who are under-vaccinated in the elderly. So therefore, children are not suffering the severe disease. So if we are to prep for the wave, we should be shoring up on people who are in harm's way. Children do get the infection, but they're still not getting severe disease. So we have time to vaccinate the children. We'll have to circle back to that discussion a little later. The only question is, what do we do with adults?
What do you think about booster?
Yeah. I think it's about time we do it. If you look at the study which came out in Lancet yesterday, looking at 22 million odd people from Brazil and 2 million people from Scotland, there is a fall in the protection given by 2 doses of the vaccine. Having said that, there's one major caveat. They excluded people with hybrid immunity. Now that's the curveball over here. That's the curveball which I am not able to harmonize in the data set. How much of a role will hybrid immunity play? We know that natural immunity plays no role in preventing infection from Omicron. Severity is a different issue, but it doesn't give you any protection against infection with Omicron. On the other hand, hybrid immunity, 2 doses of the vaccine with the natural infection, how much will it protect? Again, if you look at European data, less than 70% dual vaccination overall is still not good enough. Our country is only about 40-45% dually vaccinated. That's a little concerning in the adults. So I think we have a couple of challenges which we can't assess. Overall, what I can clearly see is that it's very unlikely that we'll have a wave as strong as the Delta wave. But having said that, I think it is going to be fairly possible that it will be comparable to the 2020 wave.
Really appreciate your findings, your suggestion, your analysis and your projections which are based on science and not politics, and that is something that we are grateful for. Dr. Swaminathan, Professor Vidyasagar, thank you very much.